Okay, so in this video we're going to be doing talking about ultrasound and its therapeutic benefits. For my patient here, I have Ronnie. He is 53 years old. He sprained his ankle 2 days ago in his backyard. He's stepping in a gopher hole. He's getting a lot of swelling and bruising around the lateral malleolus of his ankle. And so we want to be applying some non-thermal ultrasound to this area to kind of help with some of the inflammation that he's experiencing since he's still in the phase 1 of healing, inflammation stage of tissue healing. So he does have a pacemaker, and we're not going to be going anywhere near that, so that's going to be okay because that's one of the contraindications. And then also, we don't want to be going over anywhere with lessened skin sensation, but we've already done some dermatome testing, and I was able to palpate it a little bit, and he had normal sensation there, so we're good there. But yeah, so now, Ronnie, before we get started here with the ultrasound machine, I just wanted to ask you a couple questions to make sure we're not gonna skip over anything that could be dangerous, but you don't have any history of any skin cancer or haven't noticed any like weird things, moles, anything like that? Okay.
No.
Great. And then, let's see. You don't have any like open wounds or anything that I need to know about?
No.
Right? I haven't seen any by the ankle, so okay.
We're doing good.
Perfect. So I'm going to be applying this ultrasound around your ankle, underneath it, just around like the side of that ankle bone there, where it's really puffy and swollen. And you really shouldn't feel anything while I'm actually applying this treatment. But if you start to feel tingling, burning, anything, that's going to be abnormal, so please let me know, okay?
Okay.
But really, this is just going to be helping to get some of that inflammation out so that we can bring blood flow to that area, and that blood flow is going to be bringing like healing properties, help, get that inflammation down, okay? So, I'm going to get set up here. If you would like to swing around onto the table here, I'll make sure that you're well protected under your ankle. Nice, nice. And you're comfortable? Do you need any other pillows?
Maybe one for my head would be kind of nice. Thank you.
Here you go.
Appreciate
Yes,
it.
of course. All right. So to set up the machine, I am going to make sure we are on sound here, and it's showing up sound there, so I know it's going to the ultrasound head. I want to make sure we're on 20% because we're doing non-thermal ultrasound. And as far as megahertz, I want to make sure we're on 3 so that we're only going about 3 centimeters deep into the skin. Time-wise, we're going to stay around 5 minutes because we really just want to help with the inflammation and increasing blood flow. And then I'm going to get started putting gel on the ultrasound head and putting gel on the area first because I don't want to stop moving the ultrasound head once we actually turn the machine on. So, get a little there. And are we okay that I go ahead and start touching around your ankle? Okay,
Yeah,
just didn't want to scare you or anything like that. I know it's a little tender and sore still. Okay. So, going to make sure that I keep my ultrasound head moving like this, and that I stay in an area only want to stay in an area that's like 2 times the size of the ultrasound head. And so I'm going to start turning it up and hit the start button now that I am going. And you're not feeling anything except the pressure of me moving this around, is that correct?
Yep.
Perfect.